So, have you ever known somebody who had emotional blindness? They seem like a human robot, didn't really seem to have any intelligence about emotions or how to interact with other people. Well, I'm actually going to be talking about a condition called alexithymia, which literally means no words for feelings. Hi, I'm Dr. Greg, and this is Off the Couch. So alexithymia is literally a lack of emotional awareness. I became actually interested in alexithymia. I've actually heard of it for many years, and different people have described themselves that way. And they were typically the same people I kept hearing it from over and over. They were typically men who had difficulty identifying their feelings and expressed a lot of frustration and anger, and also would express a lot of somatic sensations or things in their body or illnesses. So I wanted to put this together and just really understand this concept of alexithymia. What I did find is that about 10% of the population has this difficulty in identifying their feelings, but it's really overrepresented in people who have autism spectrum disorder. It's thought to be about 50% of people who are diagnosed with an autism spectrum disorder. And that's something like, of course, autism, or what we did once call Asperger's, and now we just kind of say someone is on the spectrum. But nonetheless, this is something where people have difficulty identifying their inner emotional life. Now, you may think that's actually good, to not have to deal with your emotions. The fact is, though, we all have emotions, and identifying with your emotions is actually really helpful. It helps you to connect with other people because you're talking about and acting from your emotions in a healthy way, but it also helps you to connect with yourself, because when you can identify and look inside at your emotions and correctly identify what's going on, it's as if you've put a ground to your electricity wire, and you're allowing now that emotional electricity to go through your body. So identifying your emotions is actually a super helpful skill. So people with alexithymia really are identified as having low emotional intelligence. And it's not to say they're not intelligent. They can be extremely smart. They can be intelligent in all kinds of ways, but just have low emotional intelligence in the sense that they can't identify their own emotions. They have difficulty having empathy with other people because they don't know what's happening with other people. And they tend to look at other people's expressions and incorrectly identify what's going on with that person. They can see that there's a difference in their face, but they don't always know the word for what they're seeing. So they make a lot of mistakes. And then people might overinterpret, like say they might think someone doesn't like them because that person made a face that they didn't really know how to identify. So really having low emotional intelligence doesn't mean you're not smart. It just means you have difficulty both identifying emotions inside, identifying emotions outside, and then knowing how to interact with someone emotionally. So let's look at perhaps what is alexithymia. There's really a gold standard that was identified to identify alexithymia. It's called the Toronto Alexithymia Scale. This is actually a 20-item scale that's used in research, but there is a 26-item version that you can use in clinical practice, so some psychologists might actually be using this instrument. And if you did come to see me, that might be something I might give you, in addition to other personality tests. But alexithymia there's three categories that the Toronto Alexithymia is identifying. The number one is difficulty identifying feelings and distinguishing them from bodily sensations. Remember, I told you that a lot of people with alexithymia, or even most, tend to put their feelings into their body. So they actually are going to feel tension in their neck, stomach aches, hurts, vague aches all over their body, because they don't really know how to identify or specifically hone in on their feelings. So they tend to look at their body and feel their body in particular ways. So one of the questions on the Toronto Alexithymia scale might be, I have feelings that I can't quite identify, and that might be in the difficulty identifying feelings. The number two is difficulty communicating or describing emotions to others. A question like that might be, it's difficult for me to find the right words for my feelings. And number three is an externally oriented style of thinking. This is someone who might say, I prefer talking to people about their daily activities rather than their feelings. In fact, we kind of see this stereotype happen that sometimes people, men in particular, don't like to talk about feelings, and we hear women do like to talk about feelings. Of course, that isn't true for all men and women, but we do see this stereotype, and there may be some reason for that, which I'll get back to. So alexithymia is not a diagnosis unto itself, although of course we see it with other diagnoses. Things like anxiety disorders, especially in anxiety disorders such as social anxiety disorder or generalized anxiety disorder, or in substance abuse disorders, or in, of course, as I said, autism spectrum disorders. Now, in substance abuse disorders, it's especially interesting because you might experience someone with a substance abuse disorder as being highly emotional, but often they might have a lot of difficulty identifying their feelings and their frustrations and their inner workings, because what they've done is they have emotions and then will turn to the substances to help manage the emotion. And this cycle then continues and strengthens, so they become less and less connected to their emotions and more connected to the craving of the thing that will manage their emotion, which is the substance. Now, although it isn't a diagnosis unto itself, alexithymia, there are some things that people with alexithymia might notice. Those go with the other disorders I just talked about. One is a lack of impulse control. Two are violent or disruptive outbursts. Three, indifference towards other people. Four, difficulties with articulating emotions. Five, difficulties with naming different kinds of emotions. 6, struggling to identify emotions expressed by other people. 7, heightened sensitivity to sounds, sights, or physical touch, so having difficulty with any kind of sensation. So one question comes up for me, is alexithymia something that's inborn, where it's just part of their genetics, or is it something that's learned? Well, maybe there might be a propensity toward this kind of condition, because we do know some people have traits that might lead them to be more prone to alexithymia, but we do see a lot of evidence of learning. For example, on the Toronto alexithymia scale, we see people who come from East Asian language countries having higher incidence of alexithymia, because what we actually see in those cultures is really a lack of desire to talk about feelings on the emotional level, and more put it into intellectualized discussion and also somatic expression of those things. So it might be more cultural in some communities, because we also see in Western society that we really tend to put a lot of prize in talking about emotions, so much so that sometimes when I've traveled around the world, sometimes people will kind of laugh about Americans that we're very emotional and that we talk about our emotions a lot. But it might be a part of our culture that we really consider emotions as part of mental health. And we do see the advantage to talking about emotions and becoming connected with our emotions. Now, there's also some research to show that men might be more affected with alexithymia than women. In fact, we see an overrepresentation of men. But that might also be cultural as well, because what we see is that boys, when they're brought up, are often taught not to be connected to their emotions. Where a girl might fall and skin her knee, she might be pulled aside and her tears dabbed, and then people comfort her, and she's taught soothing and to connect with the emotion, and that she can connect with another person emotionally and things will get better. A boy that falls and skins his knee, if he cries, it might be told by the parents, get up and just tough it out. And so the boy might learn to suppress his emotion. That kind of learning over time teaches boys who become men to put their feelings down and not to connect with their feelings. And then when we get older, sometimes when I see couples in therapy, I'll often hear sometimes one partner complain about the other, that maybe when they come home, they don't talk about their feelings. They just want to close in and not talk about the day, and they're just grumpy and angry, etc., etc. But maybe part of that was just due to their learning growing up. So alexithymia, or the difficulty connecting with feelings, can have its expression in many different ways, but some of it may have just been learned as a function of our society, our gender, our culture, and our upbringing. So men might have a little more difficulty connecting with mental health issues in general, just because of their lack of touch with their own emotions, but also society's intolerance of men expressing emotions. It really becomes a part of them and a part of their understanding. What we see too is that men might be higher in substance abuse disorders, which is partly thought to be people who are have difficulty with emotional management. And also, men only account for 1/3 of outpatient visits to mental health clinics, and men also are less likely to take care of their physical health. So men don't take care of themselves as much as they could or even should. Now, let's talk about alexithymia in dreams. I think this is one of the more fascinating things, but I'll just touch on it for a minute. People with alexithymia have dreams just like all the rest of us, but their dreams often can be colorless, so they may not have as much emotional expression in their dream. And when the protagonist, or the person that they might identify most with in the dream, is having feelings, they really don't identify with those feelings, and they even have difficulty connecting feelings to the other people in the dreams. So the dreams tend to be colorless, have less emotion, but when they do have emotion, those emotions tend to be fear, and they often can have these kinds of dreams where they're nightmarish in theme. So what's the polar opposite of alexithymia? Well, looking at it statistically, it looks like the polar opposite is actually something called psychological mindedness. Psychological mindedness, which you often hear people in the psychotherapy community or people in school, they'll talk about it. It's really people who are able to connect with their emotions, able to talk about their feelings, able to talk about their inner experience. And this is really a very sophisticated skill, and it's something that really helps people in many different areas. In fact, we see people with high psychological mindedness do very well in most professions. That's a law profession, it could be psychology, medicine, government, education, any kind of profession. Psychological mindedness really aids you. But people who have alexithymia might have more difficulties in those professions because of the interaction that has to take place between you and another person. Now again, they could be just as smart, they just can't identify the emotions or what's going on in between. Now there are some things, you go, what's the treatment? But there actually is kind of a treatment you can do. The first thing you want to do with anyone who presents with alexithymia, if you're a mental health professional, is treat the underlying or the disorder that's in front of you. That's the substance abuse, the anxiety, the autism spectrum disorder, or whatever disorder the person might be presenting. But if you're someone who believes they have alexithymia, you want to identify if anything might be helping that along, like one of those disorders. But you can do some things actually to start helping you connect with your feelings. One is just to try to name your feelings, to try to look inside and see what's going on. A meditation might help with that, but sometimes people with alexithymia might have difficulty connecting that. They might have to do something more basic. I've actually used something that might seem kind of funny, but I used to use a children's book. Here's one. It's called Feelings. And this goes over feelings like fear, pain, love, feeling jealous, frustrated, alone. But a book like this, or a children's book, actually wouldn't be too far off the mark if you have trouble with identifying feelings, just to help you start to see what those feelings are. Another thing I do in therapy would just be to have a thing like this, which just says emotions, and just have examples of different emotions, because sometimes people have difficulty just naming a feeling or coming up with a word in their head, but they can recognize a face and they can recognize that they identify with that face. Just doing that work over and over, like building a muscle in the gym, actually helps people to develop more emotional awareness, which will help them to be able to identify emotions of others and help them build better relationships. I'm Dr. Greg Cason. This has been about Alexithymia. If you have any more questions, just put it in the comments below. I look forward to talking to you next time on Off the Couch.